More medications, less health. Something's broken. Traditional medicine manages symptoms, but true healing addresses root cause. I'm Josh Rimini, pharmacist turned healer. At Beyond the Pills, we merge ancient wisdom with modern day science to inspire you through stories of transformation, practical trainings, and holistic healing. Join me and other practitioners as we guide you towards vibrant health, body, mind, and spirit, and move beyond symptom management into true healing. Hello. Welcome to this episode of Beyond the Pills. I'm so excited today. I have a new friend and colleague joining us today, Dr. Fred Schiffer, who is a best-selling author and psychiatrist who's teaching people how to strengthen their brain power and improve their mental health. Dr. Schiffer is on a mission to help people understand their anxiety, addiction, trauma, and offer them effective methods to improve their well-being. This breakthrough methods have been tested, researched at Harvard, and have garnered great results. So we're going to have an amazing conversation, but we're going to talk about this, but it's transformative new book called Goodbye Anxiety, Depression, Addiction, and PTSD, The Life-Changing Science of Dual Brain Psychology. Dr. Schiffer is going to share with us an in-depth look about the book and the science behind this dual brain psychology and the treatments, while offering practical tips and tools to try it for yourself. So we're going to talk about this book, but welcome, Dr. Schiffer. How are you doing?
Great. It's a pleasure to be here. Thank you very much.
And when I read these bios, because they're not really bios, they're life missions, right? Mm-hmm. When I read these, I get so excited because the things that I read in one paragraph are so powerful. So let's dive in. Let's talk a little bit about you and who you are and where you are today. So let's talk a little bit about Dr. Fred here.
Okay. So I'm a psychiatrist, and I was trained at Harvard at McLean Hospital, and I've been on the faculty there since completing my training decades ago, and while and I also have a private practice in Newton, and I have a startup company which we actually started to get an SBIR grant, but it's turning into a real company. So many things that I'm doing. We're running a study with the SBIR grant for the treatment of fentanyl, and it has an FDA breakthrough designation, and it's funded by NIH and the National Institute for Drug Abuse, and it's our third trial with addiction, and first two trials we got remarkable results, and with this one I'm blinded, but I have to say that a number of a pretty large number of percentage of the participants who are either getting shame or active are doing very well in reducing their fentanyl or coming off of fentanyl. And
this is big. Like, these things that you just said are, one, super resonant for me, the pharmacist turned healer. Like this, we have an opiate addiction, and that opiate addiction has turned into something more addictive and more deadly, which is called fentanyl. So people don't realize, we talk in opiates. So I do want to unpack a little of this already, right? Sure. Because what I heard you say is we're doing something that has FDA, like from a pharmacist perspective, approval, right? This FDA is looking at something.
Well, it doesn't have approval. We have to get the statistician. We have to.
For intents and purposes, they're looking and they're very, very interested. Right?
Well, given us a special designation called a breakthrough designation, and so it means that
talk to people about the impact of that, right? Because we know that there's this opiate problem, and we're going to talk a lot today about the system and how it's broken. Like, I have a firm belief we all understand in this world that there's an overprescribing problem, right, in our country, which is one of the drivers. And opiate addiction has a lot to do with overprescribing unnecessary medicines, and opiates are one of them in some cases. So talk to people a little bit about this work, like what you're doing here that is, because a lot of people think of like opiate addiction as this problem, right? This problem I have with the drug. And so let's unpack a little bit about addiction, because this is a big topic that people are really concerned about, right? Especially with opiates.
So what I want to start with is the statement that I don't have any opioid addicts in my practice or in this study. I have people who are addicted to fentanyl or heroin, but what I see is that they're trauma victims, and so when you call somebody an addict, it's an insult.
Well, you're labeling them, right? There's a label. Is there psychology under that, right?
That's right, exactly right. So that they're not born that way. They don't have abnormal chemicals that are the cause. They might have some abnormal brain function because of their experiences and their behaviors. But I don't believe that there's a brain primary cause for addiction. And I'm convinced of that because everybody that I've treated over the decades with addiction has had profound trauma, often trauma that is not understood, not recognized, denied. So the trauma, it doesn't have to be a molestation or a rape or a bludgeoning or a war. It can be a rejecting father or mother, which then leads to poor performance in school. That if a child is told that they're never going to succeed, then they believe that, and it makes it harder for them to function in school. And then the teacher gets angry with them, and then the other students look down on them, and they wind up in a group of similarly troubled individuals, and they become delinquent and start drinking, and then after they graduate, they or maybe in high school, they start using drugs as but the reason, rather than saying that they're addicts or they have a drug problem, which they do, but the real problem is the trauma that they suffered, that they're suffering from, and they're looking for some kind of solution to the pain of their trauma. What we're doing is I've discovered and have a number of papers and research on this, that the trauma seems to get located in either the left brain or the right brain.
Wow.
And that it turns out that each brain can support a different mind. Now, the mind of the left brain and the mind of the right brain both have the same name and the same address and even the same social security number. But one side is more childlike and living more in the trauma, and the trauma that they don't recognize as a trauma. They just think that, they're bad people and that they deserve the criticism. Which is not true. And on the other side, there's a healthier view and more of a realization that they're valuable people, that they're lovable people. So the idea here is to treat the troubled side and to try to stimulate the healthy side. So So what we're doing in this study is an application that comes out of this theory. And the theory is called dual brain psychology. It has to do with the fact that there are two brains and there are two minds, and that they're located in the left brain or the right brain, and that one hemisphere of the brain can support a mind, and a person can actually have one hemisphere removed, maybe for cancer or a stroke.
Yeah, we've seen it, right? We've seen people be able to function on this half brain approach. So I want to pause because I'm hearing such beautiful stuff, and I want to reframe it to people too. Is you talked about trauma, and then we talked about the I call it in functional medicine, like they call it the upstream part, right? It's not the addiction, right? Not labeling the person as an addict. Yes, they have a problem, but part of the solutions that we've seen in, let's call it traditional medicine for now, is we're treating the problem, not the root cause. And so you went all the way upstream to talk about what's the root cause of the addiction. The addiction is the trauma. And then we talked about the trauma doesn't always, because there's this, trauma is a buzzword these days. It doesn't have to be this life-altering. It is life-altering for them, but it doesn't have to be this severe thing. It could be a small childhood programming that we talked about.
Exactly.
And then you eloquently talked about how this unfolds in people's lives to get them to the addiction. So there's this upstream, downstream thing that we just unpacked in a beautiful way. And now we're already getting to the part of the solution where you, as a Harvard-trained psychiatrist and psychologist and the person that understands the science, we're talking here, right? The science of the brain. And I love neuroscience. And now we talk left brain, right brain. I heard left or right brain. So I want to talk a little bit about that.
Yes.
And treating the troubled side. That was so powerful, right? Getting to the place that we're in treatment means to me like we're healing the troubled side and we're nurturing the side that's protective or regenerative. So I just wanted to pause right there because there was so much within that, 4 minutes that we talked about that were powerful. So thank you. So talk to me a little bit about this left brain, right brain approach that you're taking with this healing solution.
Right. I just want to add one other point to what.
Please do. This is why I have this. It's a conversation. It's a conversation.
So when someone is identified as an addict, and they know that they're an addict because they're out trying to purchase in an alley some opioid, and they know that they're suffering withdrawal and they're spending all their money, so they're obviously they fit this word of addict. But it turns out that to be called an addict is an insult. And in other words, if I go to an AA meeting and I raise my hand and I say, "Hi, I'm Fred, I'm an addict," it's really demeaning and devaluing, even though AA wants to say, well, it feels good, and I agree that you don't want to beat yourself, and that's the whole point that I'm getting at. But when people get diagnosed, it's always negative.
Label.
Yeah. And everybody gets told today that they're bipolar, and all you have to do is turn around and you're bipolar, or borderline. These are all really insulting labels, there's a joke, sort of, I think, from the Borscht Belt in the 50s, where a guy goes to see a psychiatrist. And he says, "So, Doc, what's the matter with me?" And the psychiatrist says, "Well, frankly, you're crazy." And the guy is really insulted, and he jumps up and down and he says, "I demand a second opinion." And the psychiatrist says, "Well, you're ugly." And this is what these diagnoses are like. They're all insults.
We could probably have a whole podcast on this because I have the same point of reference here, right? It's like labeling someone puts an energy out there, right? The energy of, and I've sat in AA meetings because I have really good friends that have gone through addiction, and they've asked me to sit in them to share the space with them. And it's funny because I didn't really I did, but I didn't. I'm glad that you brought it to attention, because whenever somebody says, "Hi, I'm Josh, I'm an alcoholic," like it never hits me right. It always hits me like, ooh, there's an ouch. So I'm glad you brought that up, because we're in a society, we talk about like the problems of traditional medicine. There's nothing wrong with therapies, right? And the way we try to work with chemistry. And I want to talk a little bit about the overprescribing of these things as well as your solution. But one of those things that we think about that I think is really important for the listeners here is, like, we have thousands of ICD-10 codes, these codes for diagnosis, right? Which you go to the doctor, he diagnoses you, and then he treats you. The diagnosis is literally a label. So in shamanic medicine, in energy medicine, there is no disease. There's no labeling of you have bipolar, you have addiction, you have diabetes. Diabetes is a dysfunction of your body. And if we treat the dysfunction now and label it as an imbalance in the body, then we're treating the body. Just like I loved how you said that too earlier, is like, you don't have an addiction. You have a problem. We should address it. But you have a trauma associated with this thing. So we keep labeling the person and fixing the symptom, in this case, the addiction, but we're never getting to the root cause. So I think true healing is, how far can we get to the root cause, right? So I just wanted, again, this is such a great conversation, because I think a lot of people, we've already got really big ideas of people to go home with. Is like, you don't have the thing. Like, it's not a thing you can put on your hand and say, here's my diabetes, I have this, right? So continue. I just want, I'm such in a good place by what I'm talking about here.
Right. And the point I want to really make is that being called one of these diagnoses, and it can be any one of them, is another trauma.
Yes.
And that it's true that John was called an alcoholic, and who opened the beer can? Well, John did, and so who's responsible? John opened 8 beer cans. So who's the alcoholic? But why did John open the beer can? That's the more important question. And so he did open the beer can, and that's a problem. And I'm not denying that that's a problem. It's a very serious problem. He can't function. But you have to ask the question, why did he become alcoholic? And that he's not an alcoholic in the terms that he's a white man or a black man or an Asian man or
socioeconomic status or like, yeah. I love when you brought that, because I am such a why guy. That's how you get to root cause, right? You ask for whys. So talk to us a little bit about how you get there, right? And then what are people? This is so beautiful. Like, I love this conversation. So I have this immense amount of gratitude right now. But like, talk to us a little bit about more. Like, what's more here? Let's unpack this more. Because it's not just addiction. It's depression. It's anxiety. We've opened up that window now of being labeled. And there's no doubt either that we're overprescribing for this stuff, it's not working because all this stuff is rising exponentially, right?
Yeah, I would disagree with you a little bit about that. Is that I think one of the unintended consequences of the response to the opioid epidemic is that people with pain are not getting treated today. It's very hard to get an oxycodone prescription.
We went backwards now. We went all the way over here, and then the pendulum now is swung to the other side.
And I think what happened was that somebody hurt their wrist. They got some oxycodone, and they noticed that they felt better. And the reason they felt better, and aside from their wrist, was that they felt better emotionally, is that opioids are good for treating trauma. The problem is that they have too many side effects. So, opioids actually they're painkillers, and trauma is painful, and so is alcohol. It's, reduces the pain, and there's also sexual addiction. There are food addictions. All of these addictions are trying to find some pleasure somewhere to counter the pain of the feeling of inferiority, but the problem is that the solutions that the immature side of us comes up with have too many side effects, and they wind up being very destructive. And so what we need is a solution without side effects, and solutions that are helpful. So what dual brain psychology suggests is that we talk with the two people inside, and I have two conversations with one person, and one side is very anxious and feels inadequate, and we try and talk with it to find out why it feels that way. And the other side, it feels pretty good and confident. And I try and enlist the healthy side as a co-therapist to help me to show the other side that it is a valuable person, or that he or she is a valuable person, and is lovable, and that there was a misunderstanding, and a misunderstanding that was not true, that they really weren't losers or inadequate, or that was abuse. And so I want to improve the relationship between these two minds. Now, how did I get to the idea that the left brain and the right brain have two different minds? So let me digress a little bit.
I want you to. This is a beautiful thing. What I also want to touch on is, are we talking conscious or under that, subconscious? So I wanted to bring those things up.
Yeah. So in my view, sorry for my hoarseness. Let me get a sip of water. I'll be right back. Can I do that?
Yeah, for sure. Okay. Yeah, absolutely.
The left brain and the right brain are both complete brains. And this was demonstrated by the Nobel Prize-winning studies called the split brain studies in the 1960s. And actually, the first ones were done in around 1940. And there were people who had severe epilepsy that interfered with their lives, and they couldn't function. They're having seizures all day long, or most frequently during a day, and on most days. And so it was decided to do a radical surgical procedure and cut the connection between the left brain and the right brain. It's called the corpus callosum. It's a connector.
Mm-hmm.
And it's a bundle of nerve fibers, sort of looks like this. It's about this size. And when they did that, the individuals had two minds that had independent volitions, independent wishes. One guy wanted to smoke, and his other hand kept putting cigarettes out. Another woman wanted to wear a dress that she was buttoning, and her other hand was unbuttoning it. It didn't want to wear that dress. In another scenarios, two hands were fighting over which sandwich to eat, and they were slapping each other. And so there are these bizarre stories, but what they really mean is that when you cut the connection, you actually have two people. And
two consciousness things going on, right? Two.
Yeah, you've got two.
This beautiful, this harmonics of like our world, right? The world. I love how this evolutionary thing happened, because it's like we live in this duality of world, good, bad, light, dark, and now we're talking your mind and the fusion of the two through this connection. So continue. I'm blown away right now. This is awesome.
Now, Roger Sperry it was the one who was awarded the Nobel Prize in 1981 for the studies. And he did hundreds of experiments with the patients. And one of the basis for most of the studies was that the way the eyes are connected to the brain, and this is standard neurologic knowledge, that if you put something to the left side of the person, it can only be seen by the right brain. And it has to do with sorry about my voice. It has to do with the way the retina is connected to the brain, and so if you hold something on the left side of the person, only the right brain can see it.
Yeah,
the left brain has speech. The right brain can't speak, but it can understand language. So Roger Sperry showed a picture to the left side of the person, and it was a woman, and he asked her why she was giggling. She happened to be giggling, and she had no idea why she was giggling. She said, "I don't know. You've got a funny machine, doctor," and this is the way it's written in the journal. And what Sperry did was he showed a Playboy nude. And only the right brain could see the nude. And in 1960s, a Playboy nude was very risque, and this woman started giggling because her right brain saw the nude and thought it was very funny or made her giggle. I don't know exactly what her experience was, whereas her left brain was completely left out of it. And you could do other things, like you could have a box of items and show a picture of, say, a pipe, and you have like 5 items in the box, and if you show it to the right side, the hand that's connected to the left brain, which would be the right hand, can easily pick out the item, and if it's shown to the left side, it goes to the right brain. In other words, the brain that it goes to can easily pick out the item, but the other side can't. And I did a study with the California series. It was 2 years after Sperry had passed away, but I worked with Joe Bogan and Iran Zaidel, who worked with Sperry, and I did the first psychological inventory of 2 split brain patients. And the way I did it was I put 2 different words that would come up on each side of a computer screen. And I asked, how much do you feel? And they would point to pegs to answer the question that went from none to extreme. And there were 5 pegs. And with each hand, they were responding for each brain. And we had graduate students watching their hands and recording their responses. And half the words were negative words like dishonest or unhappy. And the other words were the opposite, were happy or honest. And both brains got all of the questions in a different order. And it turned out that in one individual, his right brain had a very high opinion of himself. His left brain had a very low opinion of himself. And so the idea that all of the good stuff is in the left brain turns out not to be true. And that sometimes the trauma is located in the left brain. And
that's great. That's awesome, because we're talking about, like, we got a really pretty good understanding that there's 2 sides to this, let's call it equation, right? This brain, left brain, right brain. And what I just heard you say was, in order to get the treatment, we have to find the solution, and we also need to pinpoint where we're targeting, right? Because your treatment targets these specific areas, right?
Exactly. And
is there a way to find out whether it's left or right?
And we'll go into that, and I'll say, and people will be able to use this at home. But awesome. I want to say that there's a popular treatment for depression called transcranial magnetic stimulation, the TMS, or RTMS, for R's for rapid, and it's a really uncomfortable. It's a non-invasive treatment. It's electromagnet that's placed over the forehead or around over here, and it sounds like a jackhammer. And you go in, the patient goes in for about an hour session, and he listens to the jackhammer for about 45 minutes, and he goes in 5 times a week. It used to be twice a week, and now it's about 4 times a week. And it has about half the people respond to it, and about half don't. So we did 2 studies from Harvard in which we tested. We have a simple test to determine which is the positive hemisphere, and what we found was that when you stimulated, they always stimulate with TMS, the left brain. And because there's a common belief that left is good and right is bad. And but I found that that is not universally true. And in this study, there was a predominance of people who had a positive left brain. And I think that there were 35 people altogether, and 15 had their positive side was on the right side, and 20 had the positive side on the left side. So there was some predominance for the left side to be positive, but there were a lot of people whose right brain was actually the positive side.
So what I heard is, like, we gotta find the right area to treat before we treat.
Exactly. And what we found was that those people who had a negative left brain, in other words, that their perception from their left side was negative, and they devalued themselves on the left side. They had more depression on the left side. Those people did not do well. If they had a positive left brain, as in 20 people, they did very well. The people who had a negative left hemisphere and a positive right hemisphere did extremely poorly. And if you knew beforehand which side to treat, it would greatly enhance the efficacy of the treatment. But I have not, after decades of trying to get somebody to treat the right side in appropriate patients, I haven't been able to get anybody to do that. So I came up with my own invention, which I'll talk about later, about that.
This is a perfect segue to that, because we talked about this problem. We got to the root cause of it. We talked about solutions that have been beyond pills that are really effective, and in your practice and in your studies and in your experience, you also found that there was some problems with that solution, and then you came up with a better way. This is the beautiful part of the entrepreneurial spirit, right? I found a problem, I found a solution, and then I made the widget better, right? So my question before we get into that is, we talk a lot about left brain, right brain, the negative perception or the positive perception on either side. Have you seen in clinic, because this is not my area of expertise, this is your zone of genius, I guess my question is, maybe other people are asking the same thing. Is there instances where there is two positives or two negatives in this? Or do you usually see a predominance kind of like this? Like, it's not like yes, no, it's more of like a...
Okay. Let's give it a try, and I'm going to ask you to do something, and I'll show you how we determine it. And I'll answer that question. Before I do that, I want to just make a comment. You asked about whether it was conscious or unconscious.
Yeah.
And both of these brains are conscious, and they also have an unconscious. In other words, they have a limbic system on both sides. In other words, we talk about the amygdala as the fear center. Now, there are actually two amygdalae, and there are two hippocampi. There's a left hippocampus and a right hippocampus, and that's true for every structure in the brain. There are two of everything. And so each hemisphere has a frontal lobe, a parietal lobe, and a occipital lobe, and has all the components. Now, we did a study at McLean where we did MRIs, which are scans to look at the size of different areas of the brain. And what we found was that if someone has a positive left brain, emotionally positive. So, and I'll show you how to do that. That their reward center was larger on the left than the right. Their amygdala, which is the fear center, was smaller, and the hippocampus was larger. So you actually have morphologic differences that are related to the positive and negative feelings. Now, let me show you how we test this. You have an envelope, maybe a piece of junk mail handy?
Do I?
Do you have in your possession like a piece of junk mail, or a credit card or something like that would work as well?
Yeah, for sure. Let me go find something here. Do I have to read it, or is it just something I'm using?
No, you don't have to read the junk mail.
Okay.
But we now have a good use for junk mail, which we never had before. So remember, I said that the eyes are connected to the different hemispheres, and
yeah, left brain, right brain, left, right.
It's actually with the eyes. I'm going to show you something. Then we'll see. Okay. So I want you to cover your right eye and the middle of your left eye. So you're looking out the left half of your left eye. So
my right eye
and half of this. So.
Oh, okay. I'm not sure if I'm going to do it right.
Yeah, you're doing that good. Okay, that's good. Now, but make sure you're only looking at half of your left eye, the lateral half of your left eye.
I guess I'll look. The only way I can do is if I see my vision.
No.
Okay.
Okay. And I want you to think of something that would normally be upsetting. It doesn't have to be a catastrophe, but, just to be a bit, provocative. And I want you to rate your anxiety or distress, whatever you feel, from 0 to 10. Could be none, or 10 would be extreme. What do you feel?
Mild. It's pretty mild.
Okay, so give me a number.
Like 3, maybe.
Okay. Now, I want you to do the same thing, looking out the right half of your right eye. And I want you to think about the same event. And how would you rate your level of distress?
I would say it's definitely more elevated on this side.
Yeah. Can you give me a number from 0 to 10?
6, 7, maybe.
Okay. So that's a big jump, right?
It was
that's 100% increase, over 100% increase.
It was, I have a hard time labeling the number, but in my experience, just the thought of it, it was easy for me to tell that this side was my right side was more affected by that.
Right. Okay. Now, when you look out your right side, you're actually stimulating your left brain, and we have an fMRI study where we put people in the scanner, and there's goggles with tape on them. So if you look to the left, you block your right eye, and you're looking out the lateral half of your left eye. And then if you look to the right, it does the opposite, and you're looking out the right half of your right eye, and your left eye is secluded. And by doing that, we ask the people to look for 30 seconds to the left, and then 30 seconds to the right, and then repeat it. And if you look at an individual scan, you don't see a great deal. You see the occipital area, the visual area, it lights up a bit. But when we took 7 people from our lab. So they weren't patients. They were, and when you crunch the data on the 7 people, you get really bright differences. The opposite hemisphere lights up very brightly, and the other side looks dark. And it's not that the dark side doesn't have any blood flow. What the fMRI is measuring blood flow, and blood flow is an index of activity. And so just by looking out one lateral visual field, as you just did, you're actually stimulating, and we have this fMRI data to confirm that we're actually activating the opposite brain. Right. And with that activation, we're activating an opposite mind. So it's sort of that I can talk with you while you look out one side or the other, and we'll have 2 different conversations. Why don't we try that? But why don't you put it up and look out the right half of your right eye? And again, we found a use for junk mail, which I think is an important innovation. Okay. So this is how we determine which side to treat. And this is what we did with the TMS study. We just did this. We asked the person how depressed they felt, and by having them measure their level of depression, which was different in everybody, but there were 2 people who didn't feel differently, but everybody else responded. We were able to label positive and negative hemisphere. So now I can talk with you here, and So tell me how you're feeling, and how do I look? Do I look friendly or unfriendly or?
I think it's interesting. Like, just by doing this, there's this heightened level of what I would consider like unease or anxiety. Just from the perspective of how I feel, like that what's going on.
Now, it does it then come on to me? Do I look any more threatening or a different than I did?
Maybe a little bit. Maybe a little bit. Yeah.
And can you describe that?
It's hard because like part of me does a lot of like say like, oh, you look angrier or you look this way. You know, to me, it looks like you're like there's more facial emotion of negativity coming from it.
Yeah.
Okay. Right. Like almost like you look a little angrier than you are.
Okay. Now, the audience can look at my face and see whether they notice a difference because they're not doing what you're doing. I want you to look out the other side and stimulate your right brain. Remember, the eyes are crossed.
Yeah.
And so do I look any different on this side?
Perceptually, I feel like you do, right? Like I feel that there's this, it's kind of weird. It's like you can't explain it, but it's there, right? You look more pleasant to me on the side.
Now Groucho Marx told a joke in a movie, and he said, so what are you going to believe? What your lying eyes say or what I say? So in other words, what you're having is an experience, and experiences come back to the brain. So if I look good and I look like I appreciate you, that feels good. And it does good things to your brain, you know, and on the other side, if I look hostile and critical, and again, the audience can look and see if they think I changed my expression. I'm not aware of changing my expression.
It's funny because like, even as you're talking and I'm doing this, like, I'm just like, holy crap, this is cool. But like, I'm almost giddy. Like I'm laughing at like this whole like I'm happy on this. If I don't want to get in an argument, do I just look through this eye and just like move this way?
Yeah. Actually, this is a take-home gift to the audience in a way that if you have junk mail, you're in business. And if you look out, and if you look out the whole eye like this, it doesn't do anything because each eye goes to both hemispheres. But if you go like this and half of the other eye, and I just want to emphasize it because most people will go like this. So just look out one eye.
Maybe this is a great segue. One, I learned something phenomenal today that I can use.
Yeah.
Talk about it. So you have this solution. Let's talk about your book and this process.
Yes. Right. Well, what I'm trying to say is that if, you get a letter from the IRS saying you owe back taxes or something, and you're kind of freaking out, you can take your envelope and you can hold it up and you look out. It actually, you'll notice, and I think you'll confirm for me that this effect happens in seconds. It's
like, and there was no thought about it. It's like, I knew, like, as soon as I started this way, it's like, once you put your attention and awareness on it, it was like, whoa. There was no conscious thought of like which one. It's kind of like when you go to the eye doctor and he says like clear or not, like it wasn't that. It was very evident to me.
Now, some people may be thinking that I'm suggesting this to you and you're just responding to my suggestion. But I want to say that we've done at Harvard placebo-controlled studies. We've done
right?
MRIs and fMRIs and EEG studies. We've done all sorts of high-level scientific studies, and this is the first theory to come out of rigorous science, namely the split brain studies, and to be confirmed or supported by rigorous science, and all of this is published, and so once we so you can use your envelope to stimulate your healthier hemisphere, and it's a good exercise, and you can it's like brushing your teeth, it sets you, and you can do it every day, and it doesn't cost anything. And then if you want to talk with the other side, with the little boy, I do that in therapy. I would talk with you on that side and see what it reminded you of, and we would get to where the trauma comes from and why that side is upset. And that helps us to improve the condition of the troubled side. And we'll get the troubled side to talk to us about, I feel like I'm not worth much. My mother always turned her back whenever I tried to talk to her, and so we can have sort of a Socratic discussion. Was that really your fault? And I don't make statements like, you're really good, and because that doesn't work. It has to be through questions that you think about, so that you get an aha. And also, what we're doing is we're not just stimulating a hemisphere. We're really stimulating different experiences. So you have different subjective experiences, which are useful, so that if a part of a person feels inadequate and another part of them feels good about themselves, it makes the person think, well, who's right? Am I adequate or am I inadequate? And one of the ways I explain that is, the troubled side of you has an inadequacy. It's been traumatized, and so it hasn't been able to function, or it didn't do well in school, or it had ADD, or dyslexia, or it got involved with drugs. The other side actually didn't. It may have been dormant, or it may have receded. But the experiences that we have on either side become very powerful and useful, and to have two different experiences is confusing, but it's useful in questioning the negative experience.
So it's fun because you can identify the troubled area, like how you say that, and you can also talk to either side depending on what you're trying to accomplish, right? Whether you're trying to work the good muscle or heal the troubled side, right?
Right. And I try and get them to work together.
And the two.
Yeah, that oftentimes they're trying to kill each other.
Right.
And I want the healthy side to be a co-therapist with me. And I want the healthy side to take the lead, that they fight for dominance. And you can encourage dominance. Like someone will wake up in the morning feeling anxious and depressed. And they don't know why. And I think it's the negative side usually wakes up first. And
it's the survival component, right? It's the place where it's going to like, hey, I'm feeling like this is part of the fight or flight, right? It's like in that space of like, hey, I'm going to prepare for what's the worst. And so I'm waking up because I can, right? So,
there's more salient.
Doctor, now let's get to solutions-oriented space here. You've got a new book that talks all about this, right?
Right. And so it's
so let's dive in. We got to get people. So there's this book.
Yeah.
Love it.
And it covers all that we're talking about. And it's an easy read. I wrote it for a lay audience, and I wrote it to be interesting and meaningful. So it has, meat to it, but it's an easy read. And even the science is presented in a way that it's easy to understand.
Well, I would expect the brain doctor from Harvard to understand how to talk to people, right? Because people all learn at this level. I was talking to a friend the other day, like our brains are really wide. For me, the understand is like, can we talk to people like at a 5th grade level so we can understand it and comprehend it and do things, right? Yeah. So easy to read. Like if people are interested in this, which I am. So how do people get your book?
Well, if you go to Amazon.com, that's where it lives. Yeah. And it's in an ebook format and a paperback.
Amazing. And the book is called
Goodbye, Anxiety, Depression, Addiction, and PTSD, the life-changing science of dual brain psychology.
And the glasses I see there are exactly the shortcut to this, right?
Exactly. So they're the same as that, except you can wear them and you can keep them on. Most of I think all of my patients have them and wear them. They don't wear them with time, but they wear them once for an hour.
And I can't wait to dive in. So I'm going to definitely get a copy of your book, move through it. Then you can get those glasses through the book, right?
The glasses, we're working on a new design. So I might put these up for sale, but I want to sell them as a wellness device that is Dr. Schiffer's stress reducing sunglasses.
Well, I would love to. I love this part. This part of my life is awesome because I have this Beyond the Pills collective, and I talk to pharmacists on how to put wellness into their pharmacies nationwide because I own an independent community pharmacy, and there's 20,000 of those pharmacies in this country. And these are things that they could sell that have, I don't imagine there's any side effect profile to these besides better happiness and better results. So low, high impact, low downside, affordable, beyond the pills approach, getting to the root cause. Like this is amazing stuff. And this is breaking stuff.
Right. And what we're working on are a new model that's more attractive and that you can wear it on the street and nobody, they look like normal glasses.
Which is good because and then people are going to stare at you and then there's a counterproduction to what you're trying to accomplish because the brains are confused.
To wear them at home and where, they're not being ridiculed.
I love this. I've learned so much today.
And this sort of leads to what we're doing with the NIH study. So I couldn't get anybody to do the transcranial magnetic stimulation on the right side in people whose right brain was their healthier side. This has been a very hard sell to the community, the medical community. It's so new and out of the ordinary thinking. we've published in top journals, many papers and it's really good research, but it's hard to get new ideas across. And so I hope that serves that purpose.
I can empathize with that because most of my career has been rooted around don't be better, be different, but also solutions oriented, right? Like I speak from a pharmacist lens, but I get people off medication, right? So it's kind of like that, but all innovation, all science, like is all uncovering more unknowns. And so the future thinkers, the visionaries, the people that are doing groundbreaking things, like who would have thought AI would have been so what it is today. So thank you for that. Thank you for not only standing your ground and living your truth and speaking it. It's also really important for pioneers and innovators that know this knowing, this truth inside them, right? You have so much experience and you know it, but there's a lot of people that would because of some fear they have in the like I won't be looked upon as the establishment, like I'm off in that space. So I love that you are not only doing something good for humanity and doing well in the world, but you're doing it with purpose and pride. And I love that. So thank you so much for that as well.
Thank you. Well, I appreciate that.
So get his book. If this resonated with you, I'm certainly going to buy a few copies because I already have people I know that could benefit from this.
Thank you.
I can't wait to have more conversations, especially as these glasses get moving and we can start like expanding this thought into some actionable things that people can do that are a big part of what I love is you can do this with low cost, high impact and like side effects are none, right? So this is a win-win-win. So I love that. Is there anything before we wrap up here that you?
Yeah, I just wanted to say a little bit about the study that we're doing.
Yes, please. Let's do that.
So I didn't want to spend $50,000 getting a TMS device and lugging it up my 3-floor walk up. So I wanted a way to stimulate the healthy hemisphere on either side, whatever I determined, more powerfully than I could with an envelope. And so I went to MGH, Mass General Hospital, has a Wellman Center, photomedicine. And I knew that near infrared went through the skull into the brain. And we used it. You can measure blood flow with near infrared light. And sort of when you go to the doctor and they measure your oxygen saturation, they use near infrared light for that.
Yeah.
And it turns out that light can measure blood flow because it goes through the brain. So I contacted the Wellman Center at MGH to see if we could apply near infrared light to stimulate the brain. And I partnered with Michael Hamlin at the Wellman Center, and he's the world's authority on this kind of technique. It's called photobiomodulation. And we did the first study treating psychological conditions with this technique. And so what I do in my practice and in this study is we put the near infrared light over the positive hemisphere. And people find that it's about 2 or 3 times more powerful and lasts longer than the envelope technique. And so we're hoping to get FDA approval for this device for treating fentanyl addiction, depending on how our results come out.
I love it. I love it. That's amazing. So you have a technique to find out where to treat, and then you have a effective low side effect, effective, easy treatment that's non-invasive.
Right.
And so you can target the area you're treating and you can treat it with effectiveness without causing any discourse, right? So that's beautiful. That's what we want for heal. And you're getting to more of the root cause, which is more of a healing, not a symptom management.
Right.
And you're doing good.
We're trying to stimulate the healthy hemisphere and it has less trauma. And I think that we're doing that. I can tell you that in our earlier studies, we studied cravings, and we had with 4 weeks of twice a week treatments, and the treatments are 4 minutes, and there's no noise. It's very relaxing, so it's not like TMS. So it's 2 4-minute treatments. We haven't seen any side effects yet, so
you nurture the good stuff. You do it for 4 minutes twice a week. It doesn't cause any problems that you know of yet. That to me is beautiful medicine.
And we get in most people remarkable results. And we have a number of people who are coming off fentanyl or reducing their dose 90%. And it could be that it's a sham treatment that's getting that result. But I think with fentanyl, it may be the active treatment. In our earlier studies, we did cravings, and the active treatment had a 71% decrease in cravings. The sham treatment had a 35% decrease in cravings, which is about the same
as placebo
level that Prozac gets.
Right. Yeah. Well, and that's about the same percentage of a placebo effect. And I'm a big fan of nurturing the placebo effect, not discounting it. So it's win-win, right? It doesn't matter as long as we get to the result. And there is this component that would be a whole other conversation, which I also love, which is talking about how do we activate our body's own innate ability to heal. That's placebo. But we won't get into that today because this was a beautiful conversation. We're going to drop Mike now because this was awesome. Dr. Fred Schiffer, thank you so much. This has been an amazing conversation, a beautiful introduction, and I know that we'll be collaborating on some levels.
Thank you. Wonderful.
Till next time, everybody, live better, stay well. Thanks for joining me today on Beyond the Pills. If our mission to de-prescribe 10 million unnecessary medications resonates with you, share this episode, subscribe, and leave a review. Whether you're a practitioner or someone ready to reclaim your health, visit rx2wellness.com for free resources to begin your journey. Together, let's go beyond the pills and co-create a world of vibrant health and true healing. Until next time, live better and stay well.